There are three types of braces that you can use for tennis elbow, but they don't work for everybody, and for some people they can actually make your pain worse. So in this video I'm going to explain what the different types are, who they may likely benefit most, how to use them properly, and also at the end make sure you watch the last section about the signs you need to be looking out for that you need to immediately remove your brace and actually go see a doctor. For those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment of any type of injury, all done via video call. Have a look at the description of this video if you want a link to our website. It's worth noting that you shouldn't be using braces as a standalone treatment or only treatment for tennis elbow. The research shows that you actually get much better results if you combine it with other treatments. Now, I am going to make a very detailed video about the different treatments that's been shown to work for tennis elbow, because every person is different and the same combination doesn't work for everybody. If you want to know more about that, have a look. I'll put a link to that video in the description of this one. The first type of brace we're going to discuss is a wrist splint. Now, it may sound weird that you use a splint around your wrist to help your elbow pain. How does that work? So if we think of the muscles and tendons involved with tennis elbow, it's the ones that extend your wrist. So the tendons are attached to the hand and the fingers, and they run across the wrist. The muscle bellies is in this area, and then they turn into tendon again, which attaches them to the bone in this area about. Now, when you overwork those muscles, they pull excessively on the tendon, on the bone, and that's where you develop your pain. So for your tennis elbow to recover, you have to temporarily reduce the amount of work these muscles do. But the problem is, we use them in everything we do during the day. So if you open a jar, if you pick something up, if you just grip something, if you open a door, those muscles work every time. So by using a wrist splint that stops your wrist from extending so much, you can actually limit how much you use it, and that can really help you to rest it. And it can be really, really useful if you have to be in situations where it's difficult to remember to not use your hand. What does the research show? Do wrist splints actually work? Yep, the research backs it up. It shows that wrist splints are really good at calming elbow pain down. There's also a suggestion that actually they may reduce your pain more quickly than the straps we'll talk about in a little bit. And then there's one study that found that actually they work better for people over the age of 45, but we're not quite clear why that may be. Now, wrist splints are most useful for people who have really, really painful cases of tennis elbow, or very stubborn cases where the pain just does not want to settle, it doesn't want to get better. And it's because a wrist splint is really good at forcing you to rest your arm and reminding you not to use it. But it also acts as a reminder or indication to other people that actually you have a problem. So they're more likely to help you with things or more mindful about the tasks they give you. The only problem is that because it's so restrictive, it can cause you to lose a bit of muscle strength. But I wouldn't worry about that too much, because you can easily rebuild that with a graded rehab plan once your pain is calmed down. Some people also just find them too restrictive, so they can't really do the things they have to do. So it doesn't work for everybody. So what are you looking for in a wrist brace? Well, first of all, you want it to stop you from extending your wrist too much. So you need some sort of hard plastic or a metal rod or something in there that's either at the bottom or the top that stops the wrist from going up. It doesn't, most of them have it at the bottom, and if you fasten it, it will still stop it from going up. You want Velcro straps or something similar so that you can easily adjust it, that it's not too tight or too loose. And then lastly, it should rest your wrist in about a little bit of extension, so about 5 to 30 degrees is what they use in the research. And that's because that's the neutral position or the best position for the wrist to rest in. If you want to see examples of these braces, I've put links in the description of this video of products on Amazon that I found that has all the features I've just spoken about. So how often should you wear these braces and when can you take them off? Well, in the research studies, they told people to wear them continuously for 6 weeks and could only take them off when they slept or showered or did their rehab exercises. Now, I tend to be less strict with my patients. I will get them to wear them continuously for a couple of weeks until their pain really significantly reduces, but then I'll get them to slowly wean off it and only use it for when they know they're going to do things that usually aggravates the elbow. But it varies a lot per person. And personalities also matter, because especially if you've had a case that's just ongoing, it doesn't want to settle, I would likely wear it for an extended period of time, because it means that you're likely not very good at taking note of your elbow and resting it. So it really depends on the case. So the next type of brace we're going to talk about is a counterforce brace, or a tennis elbow strap. Now the idea is that you place this over the muscle bellies, not the elbow, the muscle bellies. I'll show you in a minute. And by applying direct pressure over the muscle bellies, you change how the force is transferred through the tendons onto the bone where the painful area is. That's why it's called a counterforce brace as well. Now, there is evidence that it works like they think it does. In one study where they looked at cadavers, dead people, they found that they could reduce the force on the tendons by between 13 and 15%. And when they looked at using it in live people and how active the muscles were, they found that by applying the brace, the wrist extensor muscles were less active. Is there evidence from people who actually have tennis elbow that tennis elbow straps work? Yep, the research shows that for some people it can reduce the pain immediately, but for others it might make it worse. So the pros is that if the tennis elbow strap works for you, it can allow you to do your normal activities with less restriction, while you have less pain as well, because it doesn't restrict you as much as a wrist splint would. Also, because it allows you to do your activities in a more normal way, it helps preserve muscle strength, so you don't lose as much strength while you're wearing it. And then also, they're really cheap. So if you want to try one, it's not going to break the bank if you order one and then it doesn't work and you've got to throw it away. The cons is that, yes, for some people it makes the pain a lot worse, just doesn't work. And especially if you have nerve irritation with your tennis elbow, then it will likely irritate that nerve even more. So the people they tend to work best for are the ones who don't have a super painful elbow when they're not using it. So if you're sitting at rest and you're just comfortable, it doesn't throb or is that painful. It's also not really that sensitive to being touched on the muscle bellies. So yeah, it can feel a bit stiff or uncomfortable, but it's not going to cause you a lot of pain when you do that. You can press into it quite hard. And then also people who don't have nerve irritation. If you have irritated a nerve as well, stay away from the straps. That extra pressure will likely make it worse. Okay, so what are you looking for in a tennis elbow strap? Well, you can get hard ones and you can get soft ones like this one. I don't like the hard plastic ones much because they don't allow as much flexibility in how you can adjust them. I prefer these ones. It must have straps that you can adjust the pressure, because it's all about getting the right amount of pressure for you. And then it must have a raised bit in it. So like for instance, I've got hard foam in this one. Sometimes it's a bubble. It can be anything like that. So remember, you want to place it over your muscle belly. So you do not want to go and place it on the painful area. This is wrong, because this will just press on the bone and it will likely make your pain worse, or it will just not work. You're looking for the muscle bellies. So let me go to where the muscle bellies are. First of all, muscle bellies is this bit of muscle, and you can find it by lifting your wrist up. You'll feel them move there. So it's this area there. So we're placing the brace on, and you want that positioned over the muscle bellies. So about 2 centimeters below your fold of your elbow, the main pressure should be. And then you just tighten it around that. And I can feel that it's pressing down on my muscle bellies. And how do you know that it's in the right place? Well, you test an activity before you put it on, feel how it feels, and then you put it on and you test that activity again, and it should reduce your pain quite significantly. It doesn't have to be all the way gone, but it should reduce it at least. But then you can play with it as well. What I find is, depending on which straps you use, you can either pull it this way around or that way around, that you get more of a pressure pulling it this way or pressure pulling it that way, or a direct pressure down, or just moving it up and down a little bit can sometimes make a difference, that it works better. If it hurts when you put it on, see if adjusting it helps. If it doesn't help, it's not for you. You're going to have to use a different type of thing. If you want to see examples of what Counterforce braces could work, I've put links to Amazon in the description of this video. I will say that I ordered the Body Prox one because it was cheap and I didn't want to spend much money on the video. And I'm surprised at the quality of this one. So yeah, even the cheap ones seem to be really good quality and will last a while. They will not last forever, because if you use them continuously, they will wear out after a couple of months, but this one looks more sturdy than some of the others I've used in the past. How often should you use it then, or what activities to use it for? Well, again, in the research, they got the people to wear it solidly for 6 weeks, only taking it off for showers and things. I would do it slightly differently. I would only use it when you really need to use it. So not all day long, but definitely when you're doing tasks that you know will likely irritate your elbow. In reality, what people tend to do is wear it nearly all the time for a couple of weeks, and then as they get better, they use it less and less. But then also, I would definitely take it out or off when you do your rehab exercises, because the whole idea of the rehab exercises is that it must help the tendon grow stronger. So if you're using the Counterforce brace, you may not actually get the right amount of pressure through there. So, and if your rehab exercise is aggravating your elbow, it may be that actually you're not ready for rehab yet, or you're doing the wrong exercises, so check with your physio. So if you can't do your rehab without pain, it needs adjusting, but don't wear your Counterforce brace while you're doing your rehab, because I don't think you'll get the same benefits. Now, lastly, we have tennis elbow sleeves, which is just a stretchy type of material that gives firm pressure that you pull over the elbow. Now, the idea is that it keeps the elbow warm, which some people find really useful. It also helps remind you that you need to look after your elbow, and it helps alert other people that you have an issue in your elbow. And then it also stops you from bending your elbow fully, because sitting with your elbow bent for long periods of time can actually increase your pain. I talk more about that in the treatments video, so do look at that. I'll put a link to that one in the description of this video. Is there any evidence that it works? Well, they've not been researched at all. In my opinion, it's not actually something I advise patients to buy, because I don't feel that they provide as much value as the other two types of braces. But that said, some of my patients have bought them out of their own accord and have actually reported that it really helps. So if you feel that keeping your elbow a little bit warm and just giving it a little bit of extra support might be something that's useful for you, it's something to try. The main things to look for in a sleeve is that it fits properly. It needs to feel like a comfortable hug. If it's too loose, it might not do its job well. If it's too tight, it's going to cut off your circulation, actually cause trouble. So make sure that it's a comfortable fit. How often can you wear it for? Well, you can wear it pretty much all the time. The only problem with that is that it may start irritating your skin if you wear it too often, but it's not going to stop your muscles from working properly, because you're going to use your arm as normal, so you won't be losing muscle strength, and it won't affect your rehab exercises, so you could even wear it while doing them. Now, it's important that we talk about when you should remove your brace immediately and perhaps even go see a doctor. So the golden rule with a tennis elbow brace is that if it feels uncomfortable or increases your pain, it's useless. So just take it off. If adjusting it doesn't help, then just ditch it. It's not going to work for you. So that's the first rule. If it makes your pain worse, see if you can adjust it. If that doesn't work, leave it. If it causes any tingling or numbness or funny sensations in your hand, it likely means it's irritating your nerve. So you have to check, can you adjust it? Doesn't work? Then you've got to take it off. If your hand turns blue, or you're getting a cold feeling in it, or it swells a lot, it means that you've likely cut off your circulation, so you better take it off immediately as well. But also, if the symptoms continue, so you're getting perhaps even throbbing, redness, swelling, lots more pain than what you used to have, or you didn't have much pain, now you have pain, those are signs that it could be a blood clot. Now, that is rare, it's not common, but if you get that, you need to talk to your doctor immediately, because it needs immediate attention. But like I said, those more serious side effects is really, really rare. It's just worth talking about them. Brilliant. Hope you found that useful. Now remember, if you need more help with an injury, you're welcome to consult one of the team via video call. The link to the website is in the description of this video. Take care.